My name is Kevin Rosowski from Evolution Sports Physical Therapy, and I'm here to talk to you about the MPFL and rehab considerations with MPFL surgery, most commonly the MPFL reconstruction surgery. So the MPFL is the medial patellofemoral ligament. This is a ligament that's on the inside of the knee that stops the patella from dislocating laterally or towards the outside. The ligament is most used during 0 to 30 degrees of knee flexion, or bending to 30 degrees, kind of like around here. Where that's torn, you're going to feel instability. Your knee is going to dislocate out to the side. You're going to feel unsteady, and it's going to be moving. So you can imagine it's probably a good idea to get that repaired. So in isolated cases, the research is pretty straight in the sense that it's a very good idea to get it repaired, and the outcomes are great if it's just an isolated MPFL injury. Where things get a little murky is if there's other issues going on. Let's say the trochlear groove, or the groove on the femur that the patella sits on, has some abnormalities where it's just not going to glide as easily. So doing surgery there is going to overcomplicate things in terms of the normal mechanics. The other considerations are if there's a increase of distance from the tibial tubercle, where the patella tendon that goes from the kneecap to the tibia or the shin bone, if that's too long, then there's probably some other things in place. So basically anything of the anatomy that's different is going to cause bad outcomes or worse outcomes compared to an isolated. You're not going to want to do it with arthritis if you have some bony outgrowths in different ways, just strictly isolated cases. So in those cases where it's done in isolation, when you just have that injury to the ligament, outcomes are pretty good. I've seen 92% of everything going perfectly in terms of what the research says. What's really important also is rehab. Rehab is going to be very important in this case to make sure it doesn't get stiff. We want to protect the graft, but we also need to stop scar tissue or the knee to get stuck. I know in these complications, it's the stickiness or scar tissue accumulation, or when you don't move it enough, that you have that issue. So the considerations are, we want to get the quad firing. Any knee surgery, your quad's going to be shut down. Your body's not going to be able to access that muscle because it's kind of this protective mechanism that's occurring. So we're going to want to activate the quad, get the knee moving so that we can stop the scar tissue from accumulating. Protect the graft. So protect the graft by bracing, using it so that we can stabilize during walking, because if you don't have your quad there, then you can put pressure on other structures. And we also want to avoid doing uncontrolled movements. Like, we're not going to want to do a heavy load on the knee without having your knee on solid ground, because that's going to increase the way the patella moves in a funky direction. So hope you find that interesting. That's kind of just your quick and dirty run through of what the MPFL is, considerations from a surgical standpoint, and what we would do early on. But it's a bigger road than just that, just to get everything back to function. Again, Kevin Rosowski from Evolution Sports Physical Therapy. Feel free to hit us up if you have any questions about that or other knee surgeries or anything physical therapy related.